Where you live matters. Health is often described as a product of individual choices, genetics, and access to medical care. While these factors are important, they do not fully explain why some populations experience better health outcomes than others. Public health research shows that where people live, their place, is one of the most powerful predictors of health outcomes. Place matters. Place refers to more than just a physical location on a map. It includes the environment in which people are born, grow, work, and age. These environments shape daily experiences, opportunities, and exposures that influence health over time. Place is multidimensional and includes the physical environment, social environment, economic conditions, access to services, and policy environment. Neighborhood also matters. For example, Joe and Jalen are 10-year-old and live in the same city. However, they may experience dramatically different health outcomes depending on their neighborhood. Joe may have access to safe housing, grocery stores, parks, and high quality care, while Jalen may experience exposure to pollution, limited access to healthy food, and unsafe living conditions. Zip code also matters. This concept is often summarized by the phrase, your zip code matters more than your genetic code. In many cases, life expectancy, chronic disease risk, and overall well being are more strongly influenced by neighborhood conditions than by inherited traits. In many urban areas, life expectancy can vary by 10 to 20 years between neighborhoods. These differences are not random. They're closely linked to social and environmental conditions, and these disparities are often referred to as zip code health gaps. Addressing these gaps requires place based interventions that focus on improving conditions at the neighborhood level rather than relying solely on individual behavior change. Let's take a look at rural and urban context. Place affects health differently depending on whether individuals live in urban or rural environments. Each setting presents unique advantages and challenges. Urban areas are characterized by high population density, diverse populations, extensive healthcare infrastructure, greater access to healthcare services, and public transportation systems. These environments often provide greater access to healthcare services, but they also contain significant disparities between neighborhoods. Urban residents may face environmental exposures such as air pollution, noise, and heat, as well as social challenges like housing instability and economic inequality. On the other hand, rural areas are characterized by geographic isolation, smaller populations, limited healthcare infrastructure, strong community networks, and long travel distances. Rural residents often face challenges such as long travel distances to healthcare providers, limited access to specialists, and shortages of healthcare professionals in their towns and communities. However, rural communities may also benefit from strong social cohesion and support networks. Here's a key insight. Urban disparities often occur within neighborhoods, while rural disparities often occur between regions. Both highlight how place shapes health in different but equally important ways. Cultural and community influences. Place also shape health through cultural values and social networks. In rural communities, cultural values such as reliance and stoicism may influence how individuals approach health and healthcare. These values can lead to delayed care seeking, but also reflect strong traditions of independence. In urban communities, cultural diversity plays a central role. Many cities include large immigrant populations that maintain strong cultural and social networks. Place and health behaviors. Health behaviors are not simply individual choices, they are shaped by opportunities and constraints of place. These include walkable neighborhoods that encourage physical activity, food deserts and food swamps that limit access to healthy food, unsafe neighborhoods that discourage outdoor activity, and social networks that can influence health decisions. In summary, understanding place as a determinant of health has important implications for public health practice. It requires professionals to shift from a narrow focus on individual behavior change to a broader approach that addresses the environmental, social, and structural conditions influencing health outcomes. Effective health promotion must also consider how neighborhood conditions, access to resources, and community contexts influence decision making and health outcomes.